Speaking of which, Professor, I've been asking this since yesterday kasi kahapon naman ang balita rin. Again, this is something you noted also na okay, bumababa ang R0 at nag-slow down yung new number of cases every day. But ang kabila naman yan is tumaas. You've noted a slight uptick in like by 0.2% if I'm not mistaken, yung fatality rate naman sa cases. No? I'm just
That's right.
wondering if you could parse through that particular figure, yung fatality rate and yung uptick. Is it because of new variants or is it because our public health system is so stretched?
And that's a very good question, Robbie. Yes, we did report that na nag-increase. Usually in this kind of for this kind of data, you have to look at it parang long term. So from March last year to October last year, in case fatality rate sa NCR was 1.8%. So 1.8 out of 100 are dying. So ngayon from March last year to April until April 10, tumaas siya ng a little, so naging 2.02%, which may not seem like a lot kasi roughly we're still getting 2 out of 100 people dying. Pero remember, ano na yan, average na yan including last year. And in fact, we're looking at data from March 28. So mixing span lang. So this is subject to syempre, statistical variations. From March 28 this year to present, so mga 2 weeks, we're seeing a short-term CFR, case fatality rate, of almost 5%.
Oh.
So, I mean, kasi para mahatak may average, it must mean that you're getting a large case fatality rate more recently. And this is what we're seeing. We're getting 4.9% CFR, which is troubling kasi that means dati out of 100, 2 will die. Ngayon, out of 100, 5 are now dying. That could be parang more than double the deaths that we're seeing last year, yung rate. And that is a very good question which we could not answer right now because, yes, on the one hand, may mga studies in some countries saying na the fatality rate of the variants is 50% higher. So may studies na ganyan. But again, these are fairly recent studies, so it's subject to checking pa. On the other hand, there's some argument na kaya rin mataas yung case fatality rate due to the virus, but because also the hospitals in these countries became overwhelmed, and this may be what we are seeing. Ibig sabihin, the deaths are not just a function of the virus, but yung residual effects ng not being able to get hospital care, or not getting into hospitals, or yun nga, or it could be residual effects din ng of course, ito case fatality rate due to COVID pa lang to eh. What about non-COVID cases who are not able to get hospital care because hospitals are still full? So that is a very good question. We cannot really parse through that because medyo it's hard to quantify. Pero I would imagine that it would be a combination of these two factors.
So it's not necessarily pala COVID-related yung I mean, these deaths, at least in the past 2 weeks, it's possible that they're, sabihin na lang natin, collateral damage, di ba? Na merong heart condition, but because the hospitals were full, hindi siya makapagpagamot. So hindi siya, but are they still counted as a mortality from COVID? Kasi di ba tinetest naman yung mga ganon? Di ba? I mean, I just wonder.
Right. Yeah, well, actually, Lucy, I have to qualify my statement kasi may misquote ako. And what we're looking at is mortality data specifically for COVID pa lang ito. So we haven't even counted those na yung mga situations na sinabi mo na maybe heart condition, non-COVID pero residual effect because they can't get hospital care. So ito, from the DOH data na COVID deaths, so
yes.
This is strictly COVID deaths. Of course, we have to put that in context. Yung sinabi ko 4.9%. This is a short-term period. It could be subject to short-term statistical errors. So we cannot really generalize it yet.
Okay.
But it could be, we're looking at it could be a pattern that is emerging. So we have yet to see. As more data comes in, we'll be able to see kung mag-hold yung pattern na yan.
Prof, let me see if I'm understanding you right. Baka nag-increase yung percentage ng deaths kasi overburdened na with so many patients yung healthcare facilities natin. So logically you would have less healthcare available to COVID patients.
Yes, yes, Ed, that's correct. So kumbaga, let's say there's a COVID case na if kunyari, they could get access to healthcare, baka naman mabibigyan ka ng support,
Yes.
maybe a ventilator or something to help them breathe. Kasi usually doon sila nahihirapan eh. They get pneumonia, they can't breathe. But what if they can't get to a hospital, walang hospital admission, then yung nahihirapan huminga, that may lead to mortality. So that could be one of the factors that we're talking about here, aside from yung variants being more fatal, which is not very well established yet. They have found it sa other countries, but I would say that it's very well established na mataas yung mortality rate.